Good morning, Dr. Gary here. Today's topic, we are dental practice brokers. Name of our company is Healthcare Practice Sales, LLC. Our contact number is 201-663-0935. Website is dentalpracticeguide.com. Call us anytime. The information you're about to hear is for entertainment purposes. It's not legal or business advice. We are now in 18 states selling dental practices. It's Healthcare Practice Sales LLC. And we have 8 employees, including 2 CPA accountants. Always here to help you, buyer or seller. Just give us a call. If you're a seller and you have a large practice, we'll certainly help you, especially if you're thinking about selling to a DSO. They will pay our commission, so we could be your middle person. It doesn't cost you anything. And when you work with us, we can often get your legal fees reimbursed at closing, meeting certain criteria. But we are here for you 363 days a year. We work every day except Christmas and Easter. Call us from 7:30 a.m. East Coast time to 9:30 p.m. East Coast time. We answer the phone 7 days a week. That phone is answered every day except if I'm swimming in the ocean or I'm flying. So we are here to assist you. And I can assure you, we will return phone calls. So please give us a call anytime. Today's topic is, it's getting more challenging to sell a dental practice grossing $200,000 or less, and also attempting to sell or re-rent a dental office that is empty, even though it's very well equipped, but it's empty. There's no patients. The doctor has moved on or moved the practice. Often I hear, to start with the second on the latter, often I hear doctors call me, they own the building, it's a dental office, already plumbed, everything is outfitted, maybe a little more dated, and they can't understand why they can't have ease in renting it immediately. They say, always, look how much money it would cost, maybe $350,000, $400,000 to build a dental office. Why wouldn't somebody want this to just move in? Well, just the way buyers are. They want the practice, especially if it's a practice from scratch. They want it in the location they want the colors they want, the equipment they want, the setup of the rooms. They want everything perfectly the way they want. If they're going to build an office, they're going to build it their way. Even though having your office would save hundreds of thousands of dollars sometimes, doesn't matter. It could be your location. It could be a lot of factors. In summary, if you own a dental office and you own the building and you're trying to sell the dental office condo or whatever, you may be better off attempting to open it up to all parties, dentists and all other professionals, to make it move faster. The next thing is practices under $200,000, assuming they're a PPO, fee for service. We're having a harder time selling those. We can sell them, but it takes longer. And the time it takes is it's tough. It's a lot of effort and time. Sometimes you want to keep open the possibility that you may be better off just selling the records and therefore putting the patient records in good hands. Obviously, you're going to get less money, maybe 20 to 30%, 20 to 25% of 1 year's gross. If you can get it as a full down payment, we do suggest that. Not a down payment, but payment in full. It may be one of the routes to consider if your practice has been challenging with trying to sell it. It's not that you did anything wrong, it's just that a lot of the millennials that are looking now see that they have to turn the practice around. It needs some renovations, and what the rent is going to be, it may not justify buying the practice, because if your rent is starting to creep over 8%, people start getting hesitant. Especially when it starts reaching 12, 14, 17%, the rent, it can become 25% of your income based on $200,000. So you've got to be careful of that. So begin thinking about possibly, and we can handle that for you, possibly doing a record sale. It will yield less money because, as you know, a standard practice sale will be 65 to 74% of 1 year's gross. Record sale, 20 to 30% of 1 year's gross. So it's going to yield a lot less money. But it may be an alternative if the practice isn't selling, and that's kind of the direction that we're seeing with practices grossing less than $200,000. And if it's in a rural area, Whoa, that is a tough one. Rural area under 200,000 is going to be challenging to get that sold. It's just a matter of fact, and it's the statistical probability of what has happened in the past and what we're seeing. So it's a reality that you may want to face. You may not be happy about that, but that's sort of what we've been encountering. And that's something I want to share with you. Sellers, if you need advice on selling, you need an appraisal or just a quick short appraisal to get a feel for the market, what your value of your practices. If you're thinking about selling to a DSO and you're large enough, you're doing over at least 800,000-900,000, although a lot of them prefer over $1 million. We can help you with that because they pay our commission depending on which one we choose. There's some great ones out there and some ones that are a little shaky, but we can help you in all regards. So call us anytime, buyer or seller. We're here to give you some free advice. Calling you from the Jersey Shore. We're having a great time in the middle of August. We hope this goes right to January. Wouldn't that be great? I don't think so. We will be calling you from the other states we're in. We're in Arizona, we're in Florida. We'll be doing some live broadcasts from there, some YouTube, so stay in touch with us. Thank you, bye.